Hey guys, it's Dr. Adrian, and in today's video I would like to answer your question: do acid blockers destroy your thyroid gland? So if you are familiar with this topic of acid reflux, you are also familiar with its symptoms. The most common symptoms of acid reflux involve heartburn, cough, hiccups, a bad breath, bloating and gas. Also, you may be suffering from chest pain, unexplained chest pain, and sometimes regurgitation of your food. So the food is going up to esophagus from your stomach. If that's you, or if you've had these symptoms in the recent past, this may mean that you are suffering from acid reflux. Usually, if you go to the doctor, or maybe you've already gone to a doctor, he or she would prescribe you PPIs or H2 blockers, which are anti-acid medications, so-called acid blockers, and they are supposed to be helping you with this condition and with its symptoms. The problem with these medications is that they do not fix the root cause of this condition. And funny enough, if you actually take the package of the medication and you see the back label, it's actually written, do not use more than 2 weeks. So even the pharmacological companies, they are aware of it, that these medications shouldn't be actually used long term because they just help with symptoms, but they don't really fix the condition. Okay, so this is the first side effect, no root cause fix. Another thing is that these medications may cause SIBO, because these medications interfere further with the acid production. They actually can trigger, overgrowth of bacteria in your small intestine, which we call SIBO. Another thing is that they may interfere with vitamin B12 absorption and also with the absorption of, for example, iron and magnesium, which are super important for the health of your thyroid, but also your overall health. And the last thing is that they may actually trigger inflammation, because the more you take this medication, the more you don't, fix the underlying root cause. This inflammation just accumulates. These medications, in addition, interfere with the acid production, and that's why you suffer from this chronic inflammatory state in your body. Okay. So what can you do instead to fix this acid reflux and prevent using these medications? To not have this, negative effects on your body, but also on your thyroid gland, because these medications also, in addition, they actually lower the absorption of the thyroid medication. So that's why you may end up, using these higher doses, and this is not something that you actually want. So the first thing that you want to do is to quit sugar, dairy, and gluten. All of these three things are very strong triggers of acid reflux. If you don't quit them, you will be having reflux over and over, especially if you are very prone to this acid reflux disease. Okay. Second thing is you want to try apple cider vinegar. I know it's a little bit confusing putting more acid on acid, but actually it has to do with the physiology and the mechanisms inside your body. So the way it works is that you actually want to prevent the acid from going up to your esophagus from your stomach. And we have a valve which is called lower esophageal sphincter, and this sphincter is supposed to be closed. Okay. However, if you have this low stomach environment, low stomach acid environment, this valve will not be closing properly. So you want to actually acidify your stomach environment to help this valve to close, and you in this way prevent, acid going up from your stomach to your esophagus. So you want to give it a try for 2 to 3 days, and this should help. However, some of you will react in a bad way to this. This means that you have high stomach acid. So if you react in a bad way, you skip this point 2, okay, after these 2-3 days of trial and error, and you go to point 3. Point 3 is a protocol for high stomach acid, okay? So if you suffer from high stomach acid, you are super inflamed, this protocol will help you to decrease this stomach acid, decrease the inflammation, so you can get better, in like 3-4 weeks. And then after these 4 weeks, you can try this apple cider vinegar protocol. So the way you do this second protocol, point 3, is you start taking Zinc-l-carnosine 25 milligrams a day. In addition, you take H-Boss anti-inflammatory formula. You will find it on our website, h-boss.com. This helps to decrease the inflammation. And the third thing is DGL Licorice root, 400 milligrams a day, twice a day. Okay, so either before your meals or after your meals, preferably with your lunch and dinner, but you have to make sure that you take it twice a day. And this protocol should help you, as I was saying, to decrease this acid, decrease inflammation, so you can get rid of these symptoms. You can, stop these medications eventually, and then after 4 to 6 weeks you can jump into this first protocol. So point number 2, which is apple cider vinegar, 2 teaspoons a day before your meals. So that's it, guys. If you have any questions, comment below, and I will see you in the next video.